Hello, I'm Dr. John Kruse, and today I'm going to be talking about sleep apnea and ADHD. Again, I'll be talking for about probably 15-20 minutes. If you have questions while I'm talking, you can certainly type them in and I will get to them at the end. This will be posted later on both Facebook and YouTube, so if you have questions later, you can also write them in and I'll get back to them. And warning that next week I will not be doing a Facebook Live. I'll be traveling, so the next talk is going to be on June 4th, Friday at 11. So why would we even look at sleep apnea and ADHD? One's this breathing condition during sleep, and one is associated with attention, impulsivity, restlessness during the daytime. Is there any connection? And the simple starting point from a number of different studies, and none of these studies are huge exhaustive studies, but there's sort of at least some consensus in the data that roughly 20-25% of kids who are presenting at ADHD clinics have measurable degrees of sleep apnea. And conversely, of those kids who are being treated for sleep apnea, if you do ADHD survey studies on them, about 20-25% of kids, and sleep apnea in kids is pretty rare, but about a quarter of those who have sleep apnea in childhood have robust full set of ADHD criteria as well. Unfortunately, as in much of the ADHD world, most of our research is on kids, and there's much less epidemiologic data on the co-occurrence of sleep apnea and ADHD in adults. And I'll get back to that later. So what in the world is apnea? Apnea simply means stopping breathing without breathing. It's closely related to the term hypopnea, which means lower reduced breathing, shallower breathing. So hypopnea is not a Korean boy band that's based in Hawaii or anything. It's a cool sounding word. So either partially reducing your breathing or stopping it completely is actually, during sleep, is not that uncommon an occurrence. So most normal people have at least a few apnea episodes during their sleep, usually posturally related. So for our most commonly the definition used for having sleep apnea as a condition is that you have at least 5 episodes an hour, and episodes are usually defined by a certain duration of time without breathing, more than just a few seconds, and often using oximetry to measure your blood oxygen levels. Oxygen levels have to dip below a certain amount. So any just brief pause would not qualify for sleep apnea. So even though the cutoff is 5 in most studies, using sort of full-blown robust episodes, there's some people who are having as many 60, 70 episodes of sleep apnea an hour. That's averaging more than 1 a minute. So this can be a tremendously disruptive experience during sleep. So most of the time, that the origin, the cause of sleep apnea is divided into 3 big categories. One is obstructive sleep apnea, where the passageway, the airway from your mouth through the trachea, through your throat, to the trachea, to the lungs, is blocked somehow. So there's an obstruction. And most often it's either tongue, back of the throat, relaxation, the pharynx, larynx areas. Sometimes there are profound nasal septal deficits, so nose breathing can be blocked, and that could cause some obstructive sleep apneas. So central sleep apnea means that it's coming from the central nervous system, so your brain is not sending consistent signals throughout the night to keep breathing. And central apnea is much, much less common than sleep apnea, or than obstructive sleep apnea. So less than 10% of sleep studies that reveal apnea, sleep apnea, are attributable to central sleep apnea. More than 90% of sleep apnea syndromes are obstructive sleep apnea. And you can have a combined type where there's factors of both a central process from the brain down and a physiologic bodily obstructive component to it. So who gets sleep apnea? I mean, one is it's not that uncommon in our population. Research from 15, 20 years ago is suggesting maybe rates as high as 7 to 8% of the general population. Some of the studies now are suggesting rates closer to 10%, and you'll see why in a minute. We know it's almost twice as common in men as in women, and much of the theorizing behind that is that it is a real difference, largely due to male sex hormones having a big impact on size and muscularity and the amount just of tissues there in the throat that could be blocking or could be relaxed and block when they are more relaxed. So age is also a huge factor. This goes up significantly with age, and that probably has to do more with sort of the laxness or looseness or how much muscle tone is reduced during sleep, so more prone to airways collapsing completely and blocking the flow of air. And obesity, we've known for years, is a major factor. So if you just have more fatty tissue around your throat or neck, then it's going to be more susceptible again to collapsing on itself, obstructing the flow of air. And much of the current understanding of why this may be becoming more common over time is because of increasing obesity rates. That's not obstructive sleep apnea in my room. That's my furnace is going. Sorry, I tried to talk over it, and hopefully it won't be too distracting. So other significant risk factors for sleep apnea: allergies, so people who have nasal swelling, throat swelling, other structures that can swell in response to environmental triggers are more likely to have sleep apnea problems. And people who are drinking, so alcohol, remember, is a muscle relaxant, and again, over-relaxing these airway musculature can cause them to collapse and block it, and other drugs that are muscle relaxants. And I want to make a big pitch here for, not as commonly now, but 20, 30 years ago, and still FDA approved for sleep, we had some of the benzodiazepines, some of the Valium-like drugs, and particularly Halcyon, which is triazolam, Restoril, which is tamazepam, Cirax, which is oxazepam. Benzodiazepines, which are used for treating sleep, have, in addition to sedating properties, have muscle relaxant properties. These are really bad drugs to be using if you have some element of sleep apnea, because yes, they're helping you fall asleep, stay asleep, but they're also likely contributing to making sleep apnea worse. So clinically, what does sleep apnea look like? I mean, if you're in the same room with someone, the classic picture is someone who's loudly snoring, and then there's a dramatic pause in sleep as they're going through an apneic episode and no sound at all for 15, 20, 45 seconds or so, and then they sort of wake themselves up. So as the carbon dioxide levels rise in the blood, it's usually increases in carbon dioxide level that is a signal or trigger to breathe. It's not a deficit of oxygen. So if you're just holding your breath to see how long you can hold your breath and it gets more and more difficult, you're not usually fighting oxygen deprivation. You're fighting carbon dioxide oversaturation. So again, the classic pattern, someone snoring and then suddenly waking themselves up. And again, some people are doing this 20, 30, 40 times a night. So that's the nighttime presentation. What result does that have during the daytime? Far and away the commonest symptom of sleep apnea is excessive daytime sleepiness and fatigue in the face of getting sufficient hours of sleep. So again, this is clinically, we look, when someone says, oh, I'm tired and fatigued and falling asleep all day, the first question you should be asking is, how much sleep are you getting each night? If they're only getting 4 to 6 hours and they think, oh, that should be enough, I used to be able to do it, that's almost certainly a picture of sleep deprivation. But if they're getting a full 8 hours, or even often they're sleeping 9, 10 hours and still feeling fatigued when they get up, then that's a strong suggestion that it's worth evaluating for sleep apnea. I'll also just point out that although we often blur and confuse and sort of just conflate sleepiness and fatigue, they are separable different processes or problems. And most people with ADHD already know this because they can recount numerous times in terms of going to sleep where they are fatigued, they've had a either exhausting social day or intellectually demanding or physically they're pooped, but they just can't get to sleep, their mind is restless. So again, with sleep apnea, it's common to have both daytime sleepiness, which means it's much easier to fall asleep, you can sleep at the drop of a hat, and fatigue, which is more simply tiredness. So both are really common symptoms of sleep apnea, and these are not the only symptoms. So those are the day-to-day functional ways they mess with life. But we know that there are several serious health consequences of sleep apnea. So one, rate of heart attacks is higher, rate of strokes is higher, rate of diabetes is higher, rate of hypertension is higher, rate of dangerous arrhythmias in the heart is higher, rate of having multiple car crashes, MVAs, vehicle accidents are higher if you have sleep apnea. And many of these, although many of these overlap with obesity and some of the other age risk factors that themselves predispose to sleep apnea, very clearly sleep apnea beyond just age, beyond just being overweight, contributes to, has a causal effect with some of these other serious health problems. So that's all general health, which is certainly important, but we're here mostly talking about mental health and ADHD in particular. So far and away the most common symptom of people who have sleep apnea is 95% of them have problems with attention during the daytime. And this is not just an attention problem. Problems with moodiness, irritability are common. Problems with sometimes physical restlessness are not uncommon. Problems with concentration, a whole host of ADHD-like problems are extremely common in those who have sleep apnea. So one last thing, sort of focusing only on the sleep apnea, and what do we do about it if we have sleep apnea? So for years, what are considered sort of the definitive treatments have been either CPAP, which is continuous positive airway pressure. So you're blowing air into the airways to keep them open, to maintain an opening. I mean, usually air is flowing out during expiration and we're breathing air in. Again, this is blowing air in continuously. You're still able to expel air, but it's maintaining continuous positive airway pressure. And they do have variations of this in different forms that aren't continuous, but they're still commonly linked as CPAP or devices, and they work really well if you can use them, but lots of people have either trouble adjusting to the mask, and 30 years ago they had only a few standard sizes and formulations, and now they have nasal cannula forms and just the mouth, just the nose, softer openings, contour to different people's faces. Still, many people have trouble adjusting to the sensation of something on their face and take them off during the night. And many people also have trouble adjusting to having air blown into their lungs all night, and particularly dry mouth, even though most of these devices have humidified air, so it's not drying air, but it can be uncomfortable, and for many people it can be difficult to learn to use them. I've had some patients who actually hypnotherapy was amazingly effective in just a session or two, getting them to use it. And one of the practice usually helps, particularly practice with a positive outlook that with practice I may get better and more comfortable using it. The other approach for years has been a variety of different surgeries, including, particularly in kids, it's tonsillectomies and adenoidectomies, which can be helpful. In adults, it's more often soft palate, pharynx, it's not usually just tonsil and adenectomy that is going to be helpful, and there's a variety of different surgical approaches and lots of rivalry between different surgeons and oral surgeons and dental surgeons, and not huge amounts of definitive data as to which approaches are better. There's also a host of non-surgical interventions, including mouth guards, which keep the jaw or mouth open, nasal opening devices, which keep, hopefully, septal deviations and others to be less of a problematic issue. And the other approach, commonly the medication approach to sleep apnea, is giving medications during the daytime that keeps someone alert and awake, and those are usually either stimulants, like the exact same Adderall, Ritalin used for ADHD, and modafinil Provigil, which are often called non-stimulant stimulants. So jumping back more directly to the connection between sleep apnea and ADHD. So there have been probably by now almost a dozen studies, all in children. I haven't found a single adult study looking at children who had obstructive sleep apnea and met full criteria for ADHD. And most of these studies were comparing kids who had some of these definitive surgeries to treat their obstructive sleep apnea. Some of them compared a surgery group to a group that had medication, again, to keep them alert during the daytime. And a variety of different measures, again, separate. Here we're looking at what they were measuring to study ADHD efficacy. So these were people who had successful results in terms of airway passages improved, sleep apnea, obstructive sleep apnea was resolved in these studies. And again, collectively looking at these maybe dozen studies now over time, a variety of measures of ADHD showed not just some improvement, but improvement to as good as a control group of kids who didn't have any ADHD. So measures of attention were improved, measures of restlessness improved, measures of using the TOVA, which we've talked about in another speech talk here, impulse control, response time, showed improvement. Things like the Conners ADHD scale, which is measuring a broad variety of daily life ADHD symptoms, showed improvement. Again, not just of improvement, but in some studies, complete remission. And other scales looking at measures of oppositional behavior have shown substantial improvement. So again, in some cases, kids who had an ADHD picture, who had treatment, surgical treatment for their sleep apnea that was caused by obstructive sleep apnea, have had complete resolution of their ADHD symptoms. Again, I have not found a single study looking at this in adults. I'll say, so what can I say in adults? And I'll bring up case examples. So I think this is, not just I think, I've seen one case where someone who had ADHD had their ADHD resolved with a CPAP machine. So I'll say a little more. This is a gentleman who was working with a good therapist who was treating him for profound depression. He was a professional working in the finance industry. He had a relationship. So, he was working, he had a relationship, but profound depression, largely related to family losses, and this goes back in time a bit, but having essentially his whole friend network being decimated and killed off by AIDS. He himself was HIV negative, but essentially all of his friends lost. Profoundly depressed, not making much progress in therapy with this good therapist, referred to me for medication for depression. Treated the depression with some medications, but one of the hallmarks of this patient's depression was excessive amounts of sleeping. So they did hold down a full-time job, but they essentially came home, went to sleep. They had a partner who was a long-distance, different side of the bay in San Francisco partner, so they did not live together, and that's significant for a reason tied in with the sleep apnea. So excessive daytime sleepiness during the daytime persisted despite it was Wellbutrin that we used. It's just usually an arousing antidepressant. And during the weekend, this person would routinely sleep at least 16, 18 hours a day. So they would not wake up till 1, 2 in the afternoon, and then they would get in a few hours, but they were back to sleep at 7, 8 at night. They did have a whole host of ADD symptoms that were still present, even with a robust dose of Wellbutrin. So we treated the ADD symptoms with methylphenidate, with Ritalin, with substantial improvement in much of the ADD symptoms except the excessive sleepiness. And literally for years, I was begging this person to get a sleep study to see if there was sleep apnea. And partly because he was awake so little of his non-work time, and I think also partly because he did not have a partner sleeping in bed with him and hearing him snoring each night. So getting back clinically to, this is an aside, virtually everyone with obstructive sleep apnea snores loudly. Now there are certain snorers who don't have sleep apnea, but if you have obstructive sleep apnea, and it's not absolutely everyone, but it's a huge tip-off or indication, and in fact, if you're not snoring, that's drastically should lower the risk or worry about whether obstructive sleep apnea is occurring. So anyway, finally, after years of begging, pleading, prodding, suggesting, he finally got his sleep study, and lo and behold, he had profound sleep apnea, started on a CPAP machine. Daytime sleepiness receded significantly. Interestingly, in general, weekends got better, but I think he had also developed excessive sleeping as an avoidant technique of shutting out the world and not dealing with it. So although in general weekends are much better, there are some weekends he still sort of retreats and does sleep a lot. But the other, getting back to the ADD, so this is someone now on Wellbutrin, Ritalin, and CPAP, and we were able to, once he got on the CPAP, and he was also actually on Abilify to help the Abilify to help the antidepressant work better for the depression, probably, and I've seen other cases, Abilify helping for ADD. So we were able to stop the Ritalin completely, stop the Abilify completely, reduce the dose of Wellbutrin, and no ongoing ADHD symptoms, depression remains in remission. So I would classify him as someone whose ADHD symptoms did resolve completely with CPAP. There. So technically, some people would say, okay, that's pretty clear, obstructive sleep apnea causes ADHD. Technically, part of the definition of ADHD is all that your symptoms have to not be attributable to another psychiatric or physical health condition. So if it is obstructive sleep apnea causing an ADHD picture, we would say that that is obstructive sleep apnea mimicking ADHD and not causing it. But there's a significant question in whether in some of these kids who have obstructive sleep apnea where it's causing ADHD symptoms, again, knowing that obstructive sleep apnea over time does have effects on the body, again, remember the rates of heart attack, stroke, diabetes, hypertension, this is something, are we, in fact, causing some cases of adult ADHD from childhood obstructive sleep apnea that aren't being corrected or identified or treated properly? And we don't have definitive data on that. It seems likely that at least in some cases we are causing that. And I know I'm going long in this, but I'll say one other flip side of the question is, could ADHD be causing obstructive sleep apnea? And we know that ADHD is strongly correlated with a host of sleep problems, including restless leg syndrome, including circadian sleep problems where there's delay in sleep, and again, obstructive sleep apnea is overrepresented, and possibly central sleep apneas as well. So these two conditions are related. If sleep apnea is there, it certainly makes sense to treat the sleep apnea, and it may have substantial impact on ADHD. On the other hand, I would say the data do not support that the majority of people running around with ADHD have it because they have sleep apnea. So again, that's all for today. I'm not seeing any questions yet, but I heard some strange beeps as I was talking. Next week's topic, again, 2 weeks from now, not next week, 2 weeks on June 4th, I'll be talking about ADHD and psychosis. What's the connection? That's all.